check him not again. Thank you so much.
Thank you, Dr. Hussam, for this nice presentation. Now shift to my dearest colleague, Professor Yasser Elkeranu from Mansoura University. He will talk about lymphedema is much more than a swelling.
Assalamu alaikum wa rahmatullah. My talk today is to shed light on one of the most neglected diseases in medicine. Lymphedema is not a mere swelling, but it is associated with a lot of complications and effects that not only markedly impair the quality of life, but may cost the patient his limb or even his life. Actually, I won't talk much, but I will lead the pictures, do the walking. How it occurs, lead us to see. Lymphedema, if we looked at the global incidence of lymphedema, about 250 patients worldwide suffer from lymphedema. And this is much than the sum of the patients affected by peripheral arterial disease, AAA, and diabetic foot ulcers. Despite this, it is not detected by radars of physicians. 90% of lymphedema affects the lower limb. As you see, lymphedema not just swelling of a body part, as we repeat, but it is a non-relenting swelling with non-stop growth, causing much physical, mental, psychological disability to the patient. Another very important complications is loss of body confidence, disfigurement, and difficult closings, and even shows selection. How can you get like these shoes? I think it is a great suffering. It is associated with high recurrence rate after traditional surgical excisional procedures. This lady underwent 8 surgical procedures in her left lower limb. Now come to the major complication of lymphedema. Lymphedema is the strongest risk factor for cellulitis. Cellulitis is a common potentially serious infection associated with a huge cost to healthcare system with high morbidity to the patient. And cellulitis resolves with lymphedema, it is different than ordinary cellulitis. It is recurrent, more prolonged, more extensive. This is a case of erysipelas. This guy underwent amputation of his right lower limb for severe infection. As I said before, lymphedema can kill the patient. This is a young lady presented with cellulitis in her right lower limb, septicemia, DIC, with gangrene of the left forefoot, cardiac arrest, and died. Another lady with erythema with cellulitis erysipelas in her right leg, septicemia, admitted to intensive care, intubated, arrest, and death. This will lead to a marked impairment, sure, in quality of life of the patient, and a lot of social troubles and financial burden. I will come to this tragedy. This is 49 years lady presented to me not for the swelling. He believes that no treatment for the swelling, as her oncologist told her. But he came to me for this bluish discoloration. He believes that it is an ecchymotic patches. Actually, for me, not ecchymotic patches. And after biopsy, it is proved to be lymphangiosarcoma. And this was the end, this articulation and at the hip joint. Although this, she was very happy for get rid of 35 kilos hanging from her arm. How is this occur? When I asked every patient, why do you leave yourself like this? And this is the answer. I visit many doctors, and this is the reaction. No treatment, no cure, leave alone, surgery scaffold, don't touch, خليش حد يضحك عليك. This is always, this is from the patient onwards. Is actual lymphedema, no treatment for lymphedema, no cure for lymphedema. Yes, no cure for lymphedema. بس هو كان treat lymphedema. No treatment, there is cure for hypertension, for diabetes, for many chronic disease. No cure, but we can treat them. So we can treat lymphedema and help them to live a normal life. So during the last 10 years in Mansour University, we treated more than 1,000 patients with chronic lymphedema in different size. And this is the samples of our patients. We treated them by liposuction. And this by surgical excision, by hybrid surgery and liposuction. And this is example of recurrent cases. Another recurrent case. This a university student from Upper Egypt, 21 years, came to me and refused surgery, as she believed no treatment for surgery and surgery for lymphedema, and surgery is disfiguring and recurrent. She escaped and came back to me again after 1 year with catastrophic presentation, but fortunately, we were able to help her. This treatment of cases with ulceration and marked infection, lymphoedema, and this also we treated in upper limb lymphedema, vasculotomy, and even scrotal lymphedema. So, sorry. أنا بعيد يا عمو. Our presentation, highlights the special care and attention that chronic lymphedema deserves. And the physician should be aware of the great risk of lymphedema, strive to prevent deterioration and complications, and be prepared to educate and closely monitoring these patients. Thank you for attention.